Thank you for opportunity to present our study. This part of research was self-funded. The goal of our study was to reduce symptoms of overactive bladder throughout a 3-month exercise program in young overweight women with overactive bladder. The research group consisted of university students. They were selected from 2 universities according to inclusion and exclusion criteria. A total of 128 young women were invited to participate. 93 women were included and randomly divided into 2 groups, 46 in treatment and 47 in control group. We used inclusion and exclusion criteria as shown on the slide. For the evaluation of overactive bladder, we used voiding diary and standard questionnaires. For the evaluation of body composition, we used standard variables. Interventions. Experimental group underwent 12-week training program for reduction of overweight and overactive bladder symptoms with elements of aerobic training, dynamic warm-up, strength training, and static stretching. The most important part of training was strength training of deep and superficial abdominal muscles. The control group did not undergo exercise program, but was evaluated before and after 12-week period. The first results. After 12 weeks of training, we identified significant differences in body mass index, skeletal muscle mass, body fat percentage, and visceral fat area in favor of experimental group. The second results. After 12 weeks of training, we identified significant differences in number of voidings per 24 hours, nocturia, severity of overactive bladder symptoms, and symptom score of overactive bladder in favor of experimental group. Conclusions. Training program for reduction of abdominal fat with strengthening of superficial and deep abdominal muscles with elements of aerobic training, stretching, significantly reduced symptoms of overactive bladder already after 12 weeks of training program. The precise mechanism explaining the relationship between obesity, overweight, and overactive bladder are not well understood. But we believe that loss of fat tissue in abdominal cavity and waist level due to specific abdominal exercises is associated with a reduction in detrusor pressure and activity, and these factors help to reduce overactive bladder symptoms. Thank you for your attention.
Thank you. So we welcome some questions again.
Congratulations with your study. This is a very important area. But I'm wondering why you did or why you think that abdominal exercises can change abdominal adipose. It's because there is no such thing as a spot training. I mean, doing this is not going to take away the fat here, and doing abdominal exercises is not going to change the fat on the abdomen. However, aerobic exercises will change the fat percentage. So how do you explain, or why can you say that it's the abdominal exercises that's...
Abdominal exercises was only a part, but we hope that they were the most important part of this training, because this training has also part of aerobic training, dynamic warm-up and stretching, but abdominal exercises were specific and progressive, and they reduce the detrusor pressure and activity according to reduction of fat in abdominal area and waist level.
So did you have data on the waist level
Yes,
and
visceral fat area. It was part of body composition analysis with body composition analyzer.
But still, you cannot say that that's because of the abdominal training. It must be the aerobic
Maybe.
exercise. Yeah. Okay.
Bill Gibson, Edmonton. Given that 99% of people who lose weight gain it with interest within 6 months, what kind of sustainability do you see for this work? 12 weeks is nothing in a weight loss program.
Once more, please.
So, of your patients who've reduced their weight, about 0.5% of them will stay at their lower weight, and 99% of them will regain that weight. Do you think that this is a sustainable intervention? In terms of what's your longer-term follow-up plan?
Our training lasted only 12 weeks, but in other study, other interventions lasted 6 months or 9 months or more. But our patient our people have only overweight, not obesity, and they were young, and also overactive symptoms were very mild. So we decided to start with a short program, which lasted only 12 weeks.
Thanks.
And maybe in the future we will see.
Very short, yeah. Merete Tenfjord, Oslo, Norway. I was just wondering, did you have any other interventions like toilet training, having them to extend when they were going to the toilets, which could explain maybe the reduction of OAB?
Other interventions than our program, you mean?
Yeah, in addition to the strength training and the endurance training.
Not other interventions, but other intensities of interventions. For example, low intensity, medium intensity, and high intensity of our program.
But in addition to that, so would it ask to do any like toilet training to postpone?
Behavioral behavioral addition, yes.
Okay.
Yes, but at this study, no, we only examine this program and intensity at this program. Okay. Maybe in the next studies.
So you will be around for a little while afterwards. So if people want to talk to you, they can do that. Okay. Thank you.